Hello, everyone, and welcome back to Rarely Typical, a podcast where I am talking about living with a rare disease, finding hope, and living a life that is rarely typical. Today, I am joined by my friend Lisa, and we are going to be talking about one of the subjects that I get the most questions about. I am constantly getting messages. I always get questions about how I have children. And if you didn't know, with pulmonary arterial hypertension, you are told a diagnosis that you can no longer bear children. And the reason for that is usually like a twofold problem, right? The first problem is most people, by the time they're diagnosed, are in some sort of heart failure. And then the other problem is that most of the pulmonary hypertension medications are not safe for pregnancy. So when you were diagnosed, when I was diagnosed, I was told right away, you have this life-changing diagnosis. Oh, and also now you are not recommended to have children. It is high risk for you and the baby, and it's not safe. And so I get a lot of questions about it because I was diagnosed a little over a year after the boys were born. And I was very fortunate that if I had PH before, who knows what caused it. The cause for it is technically unknown. So they didn't know if it was pregnancy induced or if I've always had it. So during pregnancy, I did not show any of these symptoms. So there was no idea about whether or not I had it during pregnancy. Thankfully, everything was mostly fine and I was able to have the boys. But the biggest thing is that when women are diagnosed at a really young age, in their 20s, in their teens, they are told that they cannot have a family that they have always imagined, usually. It is really heartbreaking. It's heartbreaking for the girls that I know that have been diagnosed after me, who have gone through diagnosis and are grappling with the reality of what diagnosis looks like. And then to also be told, if you're married, if you're not married, you cannot have children. So the reason I have Lisa is because Lisa is one of those very rare people that I know who was diagnosed and also was pregnant and now has a beautiful baby. But Lisa's story is very interesting, and I'm going to let you listen to her. Hi, Lisa.
Hi, Jerry. Hi, everyone. My name is Lisa, and my story is a little bit different. I've been living with a congenital heart defect my whole life. So I'm 35, and my first surgery was when I was 6 months old. My type of pH is a little different. I'm like classified as 1 and 2. A lot of my pH is due to being on the heart and lung pump so many times because I've had so many surgeries. Last September, I had my 4th mitral valve replacement with a mechanical valve, but it was my 6th sternotomy, 7th heart surgery. So I've been through a lot. I have a pacemaker. This year has been extra busy for me. I've had a few surgeries in the last year, but it wasn't until I had my son in 2016 and I got cleared to get pregnant with him. What I know now versus what I know then, it was different. I had gotten married young and we were ready to start a family. We got cleared and the pregnancy in itself was okay. But once I hit the 3rd trimester, it really sped things up. Now, I never really had a diagnosis of pulmonary hypertension at that time. They always watched my PA pressures. So when I hit the 3rd trimester with him, things really escalated. And we did med management, and it just seemed like we were never catching up to getting into that safe part of the pregnancy to just get me a little bit further along. So I ended up having him at 32 weeks and 4 days with an emergency C-section because I was in acute heart failure. I think my whole team panicked as soon as the maternal fetal medicine nurse called my team. She was like, you guys need to admit her to have this baby. And I had my son. He was early. I spent 24 hours in the ICU afterwards. I think my management was a little tricky because at that time, we didn't have an adult congenital heart specialist on our team yet. And then I wasn't seeing a pulmonary hypertension specialist yet, because that will come. So they were just trying to do everything they could to get me to a safe point. And I only spent a few days in the hospital, like I think the 4 after a C-section. And then afterwards, I just had a lot of follow-up. So I had him in September of 2016. And in May of 2017, I was having heart surgery because I just could not bounce back 4 weeks after that surgery, I got a diagnosis with actually saying you have pulmonary hypertension. I started sildenafil, and it was okay, you're going to see the pulmonary hypertension specialist as well. And the first thing I was like, what is this going to look like for my future? And they're like, right now, you just have your son's about to be 1, and you're really lucky that you are in a safe place right now. We're not even going to talk about kids yet. And so every year after that, I was like, I feel so bad for my doctor because I love him. And every appointment I went to, I asked, what are my pressures? How do they look? Do we think we could have another baby? And every time I saw him every 4 months to 6 months, and he would just say, no, it's not safe. And I remember it was so bad. He always just said, please don't get pregnant. And I was like, okay, we won't. We also looked into alternative ways. So we looked into surrogacy. We met with a fertility specialist to see what would that look like? How much would that cost? Because that's the biggest factor. We talked about adoption. We talked about all the options we had. And I think I was 26 years old, I just kept thinking, I have one baby and I'm really lucky and I'm okay. How do we go on without a sibling? I have a sibling. My husband is one of 4. All of our siblings were having kids at the same time. And we were just going to have this one. And I just couldn't wrap my mind around it, that this was it. This was our story. This was our family. So I struggled for a few years after that, just trying to mentally wrap myself around that this was it. And 2020 came in January. It was before things were kind of chaotic, and I had a cath, a right heart cath. And I think my doctor did it reluctantly to just be like, your pressures are still high. So I think he did it more for me than we didn't really need the data at that point because we knew. So he did the cath. We had an appointment and he was like, your pressures are still high. And I don't think you could have a safe pregnancy. I don't know. His words were, I don't know if you ran into trouble and we threw you on Remodulin and cranked it all the way up, if it would even help you. And he had reached out to a specialist, a pulmonary hypertension specialist that really focused on pregnancy and helping women get through their pregnancies with pulmonary hypertension. Or she would get patients that didn't know they had pulmonary hypertension and they were hitting the second trimester where they were in acute heart failure. And she would take them on and get them to safely deliver. And he was saying her recommendations were, no, don't do it. So I said, okay. And at that point, it was like 4 years of constantly asking, can we have a baby? And I just needed a break. And I'll never forget, we saw him in March of 2020, right before everything shut down. And I said, I see my congenital team twice a year. Can we work it out where I see you in 6 months or I see them in 6 months and I don't see you for a year? So I'm seeing somebody. And he was okay with that because we had a good relationship. And he just said, Lisa, please don't be the patient that calls me and says, I'm pregnant while we're in this interim of an appointment. And I said, I'm not going to do that. I know better. I work in healthcare. I know it won't ever happen. And then 3 months later, I had to call him and tell him I was pregnant. It wasn't a planned thing. It was a surprise. And it's hard to talk about her pregnancy because it was during the shutdown. We were very secluded and there was so much fear. It, in a way, worked in our advantage. And in a way, it was hard because we couldn't talk to anybody or see doctors right away. We couldn't see them together. And I remember we had his phone number because my husband had a working relationship with him. So we knew him very well. So he texted him, hey, can you give us a call whenever you have time? And I got on the phone and I remember exactly where we were in our house. I was crying. I felt like I was a 14-year-old having to tell her dad she was pregnant, almost like shamed, I felt. And because you have everything rolling in your head, all of the risks, what is this going to be like? Am I going to make it? And I remember telling him, and he told me when I had seen him afterwards, he goes, I remember exactly where I was when you called. So we both have that. And he just said, and I was crying and I said, I just don't know how this could have happened. And he goes, Lisa, we have a bigger issue if you don't realize how this could happen when you work in healthcare and you know better. And I was like, I know. So his words were like, okay, we need to get your chart sent up to this doctor. And luckily, where I have my care, I'm in the Chicagoland area. We went up to Wisconsin for the specialist. I told him on a Friday, and I think like a week and a half later, we already had an appointment scheduled with this specialist. And I remember we didn't tell a soul besides my parents because they were going to need to help watch my son. And usually when you find out you're pregnant and you want this pregnancy, and I wanted to have a baby so bad, and you're thinking there's a very good chance this doctor's going to say you need to terminate. And I just couldn't enjoy finding out I was pregnant. I couldn't enjoy it with my husband. I couldn't enjoy anything because I just kept thinking like, how do you do something so you could stay alive for your son and your husband and your family, but want it so bad? And I remember when we drove up, the world was shut down. Everyone was working remote. And what probably would have taken us a longer trip only took us a 2-hour trip up there. And I think we were there for 6 hours. I had all the testing and we finally met with her. And she went over every single possibility of outcome, mostly all the bad first. And in the end, because we were looking at each other and I'm like, what does this mean? And she goes, but I think we could do it. I think we can get you to term. You have to deliver at 35 weeks. You have to come up here and see our high risk team. You have to deliver up here. And I'm like, deliver up here? I don't live up here. How is that going to work? And, you're kind of like in this mixed emotion because, you're going to be far from that hospital. You never know what's going to happen, especially when you're living with something like this. You could be living a perfectly healthy life, or you could be stable. And then all of a sudden something takes a turn. And now I'm adding a pregnancy in. So at that appointment, she just said, you're going to need to go on Remodulin. We need to get you up to this dose. And I think we can do this. So I'm going to send the nurse in. And so the nurse comes in and she was like, what did she say? And so I told her and I started crying. She started crying and she was like, I was really hoping she was going to say it was going to be okay. And I said, I don't know if it's going to be okay, but I think we're going to try it because she told me regardless of my decision, I needed to go on some Remodulin. So I remember looking everything up. I didn't know what Remodulin was and I didn't know how it worked. And so I started social media was blowing up and I'm like, I'm looking for everybody I can. Couldn't really find a whole lot, but I found Jerry's page. And I remember just looking through all of her pictures and I'm like, oh, she's got kids. And then I was kind of looking into all of her posts and I reached out to her and she was like, are you crazy? I don't
Look
know
at
if you
us now, though. Look at us now.
I know. And you're like, I can't believe she goes, you're going to have a baby. And I was like, all of this is going back and forth through messaging. And I'm like, am I crazy? Am I crazy to do this? So when I was 10 weeks pregnant, I got my Hickman line and started on Remodulin. And everything kind of went smooth until I was hitting about the second trimester. And I was pretty fluid overloaded. So they were really worried. My pressures were really high. I thought I was feeling okay because you just compensate and then you start to think it's pregnancy related or it's the side effects from the Remodulin because those aren't fun. So I had a lot of very close med management. At this point, still couldn't enjoy. I don't think I enjoyed, who really enjoys pregnancy as much, but I couldn't be happy that whole pregnancy. Because as soon as I would start to think things are going okay, I'd go have an echo, which I had every 2 weeks. I would go out to clinic. I would have an echo. And I started packing a bag, I think around 24, 25 weeks. I would bring a bag with because one of the precautions was if my pressures were still too high and my labs looked bad, they would admit me, put me in the ICU with a line, and then try to fluid manage me and optimize me. And I would stay there until I delivered. So all I could think about is, oh my gosh, holidays are coming up. Granted, we couldn't really spend time with our families anyways, but I had a son at home and Thanksgiving was going to happen. Christmas was going to happen. And is this baby going to make it? Am I going to make it? And so those are literally the daunting memories that I have every day. And every time we would make it 2 weeks to clinic, I'm like, okay, we made it 2 more weeks. And then when I could feel her move, I was like, okay, she's moving and grooving in there. I quit my job right before I got my HICMA line because I couldn't work. I didn't want to work bedside with a pump and pregnant and with COVID because we didn't know enough about it. So I was at home and I was really lucky. My parents really helped us. They helped with my son and just with the daily things that needed to be done between laundry and just the things around the house because I couldn't physically do it. I was too tired. The non-negotiables were delivering up there because they worked with the high-risk team. All of her pregnant patients would deliver there. So the maternal fetal doctor knew so much about pulmonary hypertension, and I didn't think that was possible. So that was helpful. And I remember the other non-negotiable was I wouldn't get to deliver past 35 weeks. So I just was like, better than 32 because I had my son at 32. But as we got closer into the third trimester, I started to get that fluid shift again. And I made it to 30 weeks and there was a care conference just to be everyone to be on board if I came in. And it was like anesthesia, OB, the OB hospitalist, the high risk team, cardiology. And I made it another 2 weeks. And then I was going up weekly for my testing. And plan was to be pre-admitted to the ICU the day before I delivered so I can get optimized fluidly and make sure everything was looking good before I went in for a repeat C-section. That's also the other thing. That first visit I had with the OB team, they asked me, do you want to have a repeat C-section or do you want a VBAC? And I looked at them and I was like, are you guys crazy? You think I want a VBAC? Pushing with all the pressure. I go, repeat C-section. And they were like, okay. And I go, and I want my tube side. And they were like, okay. Because that thing, I can't, with my congenital defect, I can't be on like standard birth control because of the estrogen. I can't, with the risk of blood clots, I can't do any of that. And I was like, we are not doing this again. I will not put my family through this again. So the week before I delivered, I was symptomatic. I had a clinic visit and I called the PA at the time and I was like, I am like, my weights are up. I'm really dragging. And I had to go get an IV Lasix push at one of the infusion centers and get me, that was a Friday. And then they called me Saturday and they're like, you're going to come in tomorrow. So I got admitted on Sunday to the ICU. I got a PICC line, I got the works, and then I started optimizing. Also, another non-negotiable for my doctor at the time because the doctor I originally saw left during my pregnancy and her partner picked me up. So this poor man had to pick me up, which we all talk about. We had all talked about afterwards and all cried about it because he was younger. He has a wife and kids, and I was probably his most complex patient. And for some of those doctors, you get it, not attached, but you develop a good rapport, a good relationship. And he said I would come home and I would be so upset. And I was like, you take it home as a healthcare worker. So I got admitted, I got the works done, and Tuesday came. I didn't have an early repeat. I think I was scheduled for 9 or 10. I don't know. And that's the biggest thing is I don't remember her delivery. It went so south. Nobody was prepared for it to go the way that it did.
Wait, let's pause for a second. I distinctly remember you texting me and being like, I'm going into birth. And I distinctly remember that Sean texted me from your phone and was like, she's alive. And that's all I got. And I waited for hours. I like sat there and I just waited. And then when you texted me, I think you said something like, it went really south. Highly do not recommend. It was like, what does that mean? And you didn't give me anything until later. And I was just like, what the heck kind of text message is that?
Leaving you on a cliffhanger.
Oh my gosh. You did send me pictures of her though. I do remember that. I remember I got a picture of her and I was like, oh my gosh, that's awesome. But then I had no idea what it went south meant and like what Sean's message meant about you being alive. And I was like, was she not alive? Did something really bad happen? And I was telling Jason, I was like, I don't know what's happening. And I don't want to bombard them with like text messages because she just gave birth. But I was like, they are just leaving me hanging.
I don't remember that day. I don't remember The last picture Sean took was me getting wheeled in so I could go get my epidural and get set up before they brought him in. That's it. I don't remember anything after that. And apparently things were good until they needed to pull her out. So they put pressure on my diaphragm when they're pulling the baby out, and she was really nudged in there. So they think what happened is I like vasovagal spasmed, holding everything. And when she came out, I got this rush of blood flow, and my arteries were like, and my brain was like, the only thing I think that really helped me decompensate as much as I did, because my art line was like a systolic pressure of 40 and I was out. Sean, your eyes were out. I just kept watching your heart rate drop. Is the anesthesiologist and the CRNA that were working that day had every drug ready. And I was not coded, but I was heavily med managed to get everything going. And like Sean and I don't talk about it a lot, and it's hard for him as witnessing everything, witnessing in that split second, your wife might die. You have this brand new baby that you don't even want to look at right now because you're focused on the wife. He went through a lot that day, and I never put into perspective what having a baby could do to him. And I don't remember the day. The pictures we have of Lucy were from one of the OBs. He went over and took pictures and sent them to my husband because Sean didn't take anything that day. So usually when moms are getting all their pictures and you're holding your baby in the OR, my baby was in the nursery next door, hypoglycemic from my meds. They gave Sean Lucy and a bottle because she needed to eat so her sugar would come up. And I could barely feed this baby. I'm looking at you and I'm trying to, they're like, I didn't want to do any of that, but make sure you were safe. And so they got me stabilized. I got back up to the ICU and I was hemorrhaging at that point. So I was already like starting to go into a descerebrate. So they were concerned that I potentially had a stroke. They intubated me in the ICU. I'm hemorrhaging. I got stable on that. And they rushed me to CT to see if anything happened in my brain. And I think it was a few hours later, I was pretty sedated. They extubated me. And I just kind of looked around. Sean, you didn't talk. He goes, I honestly thought when I was taking you home or when we would be discharged, I was going to take you to like a long-term, like a rehab, because you were going to need physical therapy and occupational therapy and that you weren't going to function as a human. So it was hours later. I don't remember that day either. He said he would ask me a question and I would look at him and then I would just stare at the wall. So again, you couldn't have visitors. We're 2 hours plus away from our homes and our families because they stayed home. And I started saying some words. I don't know if it was later that night or the next day. And there was I remember there was a basket of stuff. And I was like, who is that from? And they're like, that's from the OB team. And I was like, what do you mean? And he goes, yeah, they came by. And I was like, what do you mean? And he goes, you were out of it, Lise. And then I remember asking the nurse, like, why my throat was so sore. And she looked at me and she's, you had a breathing tube. And I was like, no, I didn't. And she was like, you did. And so hearing all of that stuff, it really sunk in. And then I couldn't leave. I couldn't see, like, I never met my baby, I think, for 2 or 3 days by the time they finally let me leave the ICU to go down to the NICU and see her. So we didn't know if I would have any deficits or what that looked like. They had an echo on me right away. My pressures were thankfully stable. So that's why they feel like it was just a fluid shift and a fluid change all of a sudden. And my brain went to protect my body, but at the same time, heard everybody. And those are the things. I don't know if I'm blocking out that stuff, but I don't remember her birth. And that's one of the things that I get really sad about because I had not a traumatic birth with Connor, but it was emergent in a sense. And I thought, I'm going to get this. We had a plan. I was going to get to do skin to skin with her in the OR and do all the things. And I did not get that opportunity. And that's a little problem because the grand scheme of things is I am alive. Oh, that was the other thing. My doctor did not want them managing my Remodulin. So I stayed on my pump during, and I don't know if he didn't trust. I understand now. I wouldn't have trusted them with my Remodulin. A lot of,
Mm.
yes. Thankfully, too, Sean got to stay with me because one of the Ks I had to change, I was so exhausted out of it. I was falling asleep while I was making my mix. And Sean, I'm just going to do it. But I also at the time didn't even know if they did my tubes. So they did do them. So we're good on that front. But I get asked a lot, like, would you do it again? Would you recommend it? I've had people reach out to me and say, what do you think? And I get it being young and then being told, like, no, your family story ends here, whether you already have children or you don't. And it's really hard. It's really hard when somebody else is making that determination for you and you don't get to pick it yourself. And I think I was finally coming to terms right before I got pregnant. We're just going to be a family of 30. It is what it is. We'll just do extra things with him. And obviously, my daughter is 4.5. She's healthy. And I'm really lucky because you don't know what the meds are going to do to her or the baby. And I was only on Remodulin. I got switched to tadalafil. And then I was on a slew of other heart medications. And you don't know. You don't know what their life is going to be like. Are you going to be around for your kids? Can you function like normal? Or are you going to need an extra caregiver? All of these things come into mind that I never really truly thought about. And it was more, I guess I didn't put into perspective what that would look like for Sean also and my family. My mom's now been a part of all of my heart surgeries and everything on that side. And she was there the day I had my son. And she even said to me, she goes, I think you need a bag that day. And I was like, no, I'm going to come home. It's fine. And then she had to witness me getting rushed over to triage, pushed through to have my son. And then she didn't get to be at this delivery with COVID. And this is really sad. Things went really south. And Sean had called my parents. He had to call my parents and his parents and say she had the baby, but things aren't good. And he's by himself. So separately, both our dads just jumped in the car and just drove. They just drove right to the hospital. They didn't know if they were going to get in and somehow finagled their way into getting into the hospital, but they couldn't come up. They sat in the cafeteria in a corner with their masks on and didn't speak to anybody, but they wanted to be there in case Sean had decisions to make. And my brother was living down south at the time and he drove up and he said to my mom, I'll watch Connor. I'll sit with him. I'll be with him if you want to go up. And she just said, I can't see my daughter like that. We talk about it now. And she goes, you know, what's the difference if I see you up there versus if I see you if you pass? I will see you and I want to remember you in a good state. And I said, oh, okay. I never thought about that. All the trauma that you don't always carry, but your family members carry. So when people ask me, what would you do? Would you do it again? And I'm like, no, because it's not just you anymore, but it's your partner. And if you already have kids, it's, do you leave that child without a mom? And your parents and your family that goes through all the trauma. So I'm really lucky. I had open heart surgery 8 months after I had my son. And then I slid through and then I was off Remodulin after. So I had Lucy in January and I got off Remodulin in May. And I just coasted until last September. I needed my valve done again. And because I've had so many surgeries, we went to Mayo Clinic in Rochester. So I'm not even a year out from that. And I have a pacemaker and I had to have that done. I had that done in January. And then in April, I ended up with an infection there. So it's been a really rough road and I'm grateful I have a really good team. And I have a team that makes sure that optimized and I'm living as much of a normal life and I can participate in as much as I can with my kids because I'm in heart failure state. I guess I'm getting to stable at this point, but I would never do this again. I would make sure everything was closed off before I would let that happen again, because I can't run around with my kids. And it's kind of like some of the podcasts I've listened to you talk about. It's like, you have this invisible illness. I don't look like I've had that many heart surgeries, and I don't have a pump anymore. And, you see my scars and people don't realize how many surgeries I've had. And when you don't do the things with your kids, or you feel like, I'm really tired today, or maybe my meds are causing a side effect, I feel so crappy when I have to ask for help. I don't want to ask for help. I'm 35. I want to be like a normal 35-year-old. So I think my biggest takeaway here is, if you want to, or you really want to do it, you need to find some doctor that has experience with pregnancy and PH and know every single risk and every single possibility outcome that can happen, because it might look great on paper. It might sound like it's not that bad in an office, but when you get to the point where you have to make decisions, or your partner has to make decisions, it's very heavy and it's very traumatic. Yeah, I think the biggest thing is, don't do it at this point.
Yeah.
Look for alternatives.
I remember when we were all hanging out and I asked Sean about that day, and he was telling me about it, and you were like listening to him and you were like, you didn't tell me that. And I just remember when he was telling me about it, he was like, I was like holding our baby and I was watching Lisa like with an entire room of doctors. And I remember him saying, I was just so scared. And Jason was standing there, and they, as a duo, right, have watched us go through the freaking ringer in some capacity. And like that, I think that what you said is really important. Like, we don't always think about what the ripple effect of us is for our families. And I guess I'm always at awe by our closest ripple, our husbands, who have had to deal with all of these things. But like, I get the question all the time, like, can I have a baby with PH? And I always think about your story, because there's obviously a good story. I know I have a friend who has a baby who had a normal pregnancy, but I feel like your story is more of what the reality looks like. Yes, my other friend got really lucky, and you've been really lucky for the most part. Like, you're healthy, Lucy is healthy, but it's still so stressful. And there's so many things that can go wrong, and things go wrong really fast when you're talking about your heart and your lungs. And I just think, there's so much heartbreak either way, right? There's heartbreak in being told you can't have kids, and being told you could die, and then actually going through the ringer where you almost died. Yeah. There's heartbreak either way, but take it from somebody who has heard it, and also somebody who has done it, which is you. And Lisa's saying, don't do it.
And I know it's hard, and it's a grieving process. And that's what I explained to my doctor when I was like, I don't want to keep coming in here just to be getting to the point where I'm like, okay, I know we're not going to have another baby. And then I know I'm going to ask. I told her, I know I'm going to ask you every time. And then I have to grieve again. It's like a cycle effect. So I'm very lucky, and I would never take it for granted, but I couldn't do it. And now my kids are getting older, and they're like, are we going to have another sibling? And I was like, absolutely not. Doesn't work. And if it did, absolutely not. I said, with all my surgeries this past year, I think my oldest one is almost 9. And I'm like, I would not survive. And he kind of understands now. What does that mean? I'm like, it's not worth it, babe. And we have a good family right now. It's a family of 4. We're good. We're good. We're not introducing anything else. Like, we're solid. But it's hard. I understand. You understand. It's hard too when people are like, oh, are you going to have any more kids? No, please don't ask me.
I'm so annoyed when people ask me that question. I get so annoyed, but also I have twins. Do you think I want more kids? No, absolutely not. I'm good. But
and they're older and independent.
Like, yeah, but why would you go? Can we just stop asking people if we're going to have kids? Like,
100%. That needs to just,
yeah. It's like such a funny like question. Like, can you not just ask like how I'm doing instead of, oh, do you want more kids? You can't ask anything else.
Yeah.
I don't know. So thank you for sharing your story. Thank you for being so vulnerable. I love hearing it. And honestly, I've heard your story like 10 times. But I love hearing it every time, because I'm always both horrified and fascinated. and it keeps me captivated. So if you're listening, thank you for listening. Thank you, Lisa, for sharing your story today. And I will be back next time with more.